Hey guys, today we're gonna talk about how your feet can actually give you some clues about your liver health. Now, I want to start off with a quick disclaimer. We're not diagnosing liver disease here. If you suspect any liver problems, you absolutely need to see a doctor and get proper tests done. What we're discussing today are just some indicators that might point to potential liver issues. So, let's dive right in and look at these little signs that could help you narrow things down. The first thing we're gonna focus on is something you might notice on your lower legs and feet. Have you ever seen small red or brown dots on your skin in these areas? They can vary in size, and sometimes they even have a bit of a shiny appearance. This is often a sign of poor circulation, which can be related to liver problems. Now, it's important to note that it could also be linked to other conditions like diabetes, but it's definitely something we see a lot in people with liver issues. You see, the appearance of your lower legs and feet can actually tell us quite a bit about your overall health. Think about it. Your heart has to pump blood all the way down to your toes and then back up again through your vascular system. If there's a problem with your liver, or even your heart, it's likely to cause some vascular issues. And where do you think these problems are going to show up most visibly? That's right, in the parts of your body that are furthest from your heart. This is why we often see these circulation-related symptoms in the feet and lower legs. It's the same reason why people with diabetes might experience neurological problems in their feet and hands. These are the most distal parts of your body, the areas that are the greatest distance from your heart. Now, let's talk about some other signs you might notice in your feet that could be hinting at liver problems. Have you ever experienced swelling in your feet or ankles? This condition, known as edema, can be a red flag for liver issues. When your liver isn't functioning properly, it can lead to a buildup of fluid in your body, and gravity tends to pull that excess fluid down to your feet and ankles. Another thing to keep an eye out for is any changes in the color of your skin, particularly on your feet and lower legs. If you notice a yellowish tint, this could be a sign of jaundice, which is often associated with liver problems. The yellow color comes from a buildup of bilirubin in your body, which happens when your liver isn't able to process it effectively. Let's move on to your toenails. Believe it or not, they can also give us some clues about your liver health. If you notice that your toenails are becoming thicker, more brittle, or even separating from the nail bed, this could be a sign of liver dysfunction. These changes happen because liver problems can affect the way your body processes nutrients, which in turn can impact the health of your nails. Now, I want to talk about something that might surprise you: the temperature of your feet. Do you often find that your feet are cold, even when the rest of your body feels warm? This could be another indicator of poor circulation, which, as we discussed earlier, can be linked to liver problems. Your liver plays a crucial role in regulating your body temperature, so when it's not functioning properly, you might experience these temperature imbalances. Let's not forget about muscle cramps. If you're experiencing frequent muscle cramps in your feet or calves, especially at night, this could be related to liver issues. These cramps can occur due to electrolyte imbalances or vitamin deficiencies that often accompany liver problems. Another thing to pay attention to is any itching or burning sensations in your feet. This might sound unrelated to liver health, but it's actually a common symptom of liver disease. When your liver isn't working properly, it can lead to a buildup of bile salts in your bloodstream, which can cause itching throughout your body, including your feet. Now, let's talk about something a bit more visible: spider veins. These are small, dilated blood vessels that can appear on the surface of your skin, often in a spider web-like pattern. While they're commonly associated with aging or pregnancy, they can also be a sign of liver problems, especially if they appear suddenly or in large numbers. I also want to mention the importance of paying attention to any changes in the texture of your skin, particularly on your feet and lower legs. If you notice that your skin is becoming dry, flaky, or even developing a leathery texture, this could be another indicator of liver dysfunction. Your liver plays a crucial role in maintaining healthy skin, so when it's not working properly, you might see these changes. Let's not forget about bruising. If you find that you're bruising more easily than usual, especially on your feet and lower legs, this could be a sign of liver problems. Your liver produces proteins that are essential for blood clotting, so when it's not functioning properly, you might notice that you bruise more easily, or that your bruises take longer to heal. Now, I want to emphasize again that while these signs can be indicators of liver problems, they're not definitive diagnoses. Many of these symptoms can also be caused by other health conditions. That's why it's so important to consult with a healthcare professional if you're re-noticing any of these changes in your feet or lower legs. Remember, your feet are like a window into your overall health. They're not just there to carry you around, they can actually give you valuable information about what's going on inside your body. By paying attention to these signs and symptoms, you can potentially catch liver problems early, which can make a big difference in terms of treatment and outcomes. So, guys, I hope this information has been helpful to you. Keep an eye on those feet, and don't hesitate to reach out to a healthcare professional if you have any concerns. Your liver health is crucial to your overall well-being, and your feet might just be trying to tell you something important. Take care of yourselves, and I'll see you in the next video.